In an ambitious push to bring hospitality back to the hospital, a small group of top Metro Detroit surgeons decided to make their own hospital, one that provided patients with the best possible care in a small, easy-to-manage environment that truly embraces top-quality patient experience. Surgeon's Choice Medical Center is a patient-centered healthcare facility and a physician-owned destination. They provide complete inpatient hospital and inpatient rehabilitation services, including diagnostic and orthopedic rehabilitative services. Today, Surgeon's Choice is administering the second dose of the Moderna vaccine to its staff and a few others.
I've been working here for 2 years, and it's been awesome. During COVID, we were able to partner with Ascension and help them out with their COVID patients because they were at capacity, so that was really nice, and that was great to see like full circle of getting everyone vaccinated. Yes, I received the Pfizer shot. I was very excited about it, and I didn't have any side effects. The difference is how they have to be kept. So the Pfizer one has to be in a certain temperature, and it has to be in a really expensive freezer, and even Oakland County is going away from using the Pfizer and switching to the Moderna because it's easier and we can get more of it to vaccinate more in the community. They're both 2 shots actually. So the Pfizer one is 3 weeks apart and the Moderna is 4 weeks apart. That's the only difference.
So today we're actually very excited. We're excited you're here so you can kind of see we're giving the second dose of the Moderna vaccine for our employees and some of the employees, their family members. The struggle has been statewide with the shortage in vaccines. We were actually told originally, like Jonathan, our PACU charge nurse, had originally stated that we were supposed to get Pfizer, and then we were told Pfizer there was no more allocation for Pfizer. So then that's when we were told we were going to get Moderna. And yes, there were some areas that we had to look at in regards to how to store the Pfizer vaccine. We are very good relationship with our neighbors next door, Providence Ascension Hospital. So we were working on a process or a pathway with them, and then we were told we were going to get Moderna, and that also kept getting delayed. So we actually had requested an allocation, and we only received 50% of our allocation because of the statewide shortage of vaccinations. And so it has been something, I think, not just our hospital, but hospitals in the area, especially offices, and we found that surgery centers were actually in a gap. So I was able to help some of our peers in the area that work for surgery centers to get their anesthesia staff vaccinated with some of the allocation that we had, because there was no allocation at the time for them to get vaccines. So we try to really help what we had and make sure the people that really were on the front lines, to exposure, were vaccinated. We were very fortunate where we had an allocation of the Moderna vaccine, and we offered it to all of our employees. We actually had an excess amount of vaccine, so we were able to let the employees put a lottery individual into an opportunity to get the Moderna vaccine. So a lot of our employees were able to get their family members, their parents, their grandparents, the vaccine. So we're trying to help the community one person at a time. Over in the year of 2020, our surgical volume did decrease to about, it was put on hold when the governor said we needed no elective cases. And then we were at about a third to 2/3 of our normal capacity. And we're still recovering from that, because obviously with the COVID testing, because that was another thing that we went through, was you couldn't get enough tests to test your staff, your patients. So we struggled with that for a little bit, and now all of our patients that come into this building are COVID tested prior to their surgical procedure. So sometimes we did have a little bit of a barrier because we couldn't get the test, so that means we couldn't test our patients, and so it decreased our volume. So now we actually do drive-through testing here for COVID testing, and our results are within 24 to 48 hours. So we are able to test all of our patients, all of our staff, when needed at this facility.
I don't know if I really do what I was hired in to do anymore. Everything has changed. Everything has been just strictly towards COVID. We partnered with Providence when it was really heavy last year, and everything has changed. How we treat patients, our visitors, our conversations, how we work here, staffing, how even just onboarding new people. down to, I mean, we wear masks all the time when we're here. So that's just something new that feels normal and natural now. So we've actually come full circle from a lot of the staff, myself included. We all felt like we went through where we had COVID. We were treating patients with COVID, set up an entire COVID unit, COVID testing, everything related to COVID, and now we're kind of full circle back through actually vaccinating people so they are safer in the community in decreasing the spread of COVID. For me, it's a big thing to do our part in the community and do what we can. And so if we can vaccinate as many people as we can to help decrease those numbers, keep everyone safer, that's what's important to me. Even people who are vaccinated, it's still important. Washing your hands, distancing, big social gatherings are still not a great idea. But just waiting, as we are waiting, the hospitals are waiting, everybody still has not had the opportunity to get the vaccine. So with that, we're hoping and we're very hopeful that a couple months from now, it'll open up and broaden to where we can provide that for, everybody, not just us, but the entire healthcare community.
With the Moderna vaccine, what happens is you get your first dose and then you wait a period of 4 weeks to get your second dose. We've had a lot of employees that have opted to get the vaccine, and we've had individuals that have opted not to. And it's all preference at this point. It's not a mandatory to get it. We do encourage all of our employees to get the vaccine, as the evidence out there has shown that it's in the 90s percentile of being effective in not getting the COVID infection. And a lot of we talk about side effects, and with vaccines that can happen. Usually they're very mild. And our employees, myself, I didn't have any symptoms from getting the vaccine, which was very encouraging. And so I'm hoping that I won't get any, because I'm getting my second dose as well today. And my grandparents also were here today, and they were able to get their second dose as well. She's just going to take down some basic information from me about myself. Right now she's getting out an alcohol swab, and she's going to make sure she cleans the area that she's going to give me the vaccine. All right. And honestly, that's all it is, right? Just one poke, less than 5 seconds. I wasn't even sure when she actually put the needle in, because it's very, very small and essentially painless. So I'm now fully vaccinated, thanks to Ashley.
So we recommend plenty of fluids before and after, making sure you're having good nutrition, getting a lot of rest. You can take Tylenol and Motrin as well to help with if you have any fever or fatigue or anything like that from the vaccination. It's all doable stuff.
Southfield has a robust recycling program, and in some ways it was put to the test during this pandemic, working as safely as possible and working remotely a great deal of the time. But when they are boots on the ground at the plant, they are taking all the proper precautions. We met Mike Sappo, general manager, and he talked about how COVID has affected recycling in Southfield.
One, we're getting more material per household than we would have in the past, simply because more people are at home and a lot of their workplace activities are now taking place at home, so people are generating more material. And then we're also seeing a great deal of more cardboard because of all the Amazon deliveries and those types of things, packages to the home. So we're seeing a lot more packaging material. For the plant employees, what this past year has meant is just a heightened attention to safety and taking the proper protocols, going through the daily screenings, making sure that we're practicing, safely, masks, all the proper PPE, social distancing during breaks and lunches, and then we've modified some of the workstations so that we can put up, plexiglass screens in between employees, so as they're here doing this important job, they're as safe as possible. And we do think this is an important job because the products that come out of this facility are part of the critical supply chain. This is considered an essential service, and the materials that we produce are going into the manufacturing stream to produce, among other things, packaging materials for food, medicines, in PPE and medical supplies that are shipped throughout North America.
One of the biggest challenges RRRASOC has is competing with the labeling on products and product packaging.
We're always wanting folks to understand what can and cannot be recycled. Obviously, they have access to what can be recycled by looking at the list that's on our websites, on the City of Southfield's website. They can access our recycling directory that's either on the website, so they can download our mobile app, the Recycling Authority's recycling directory. There's an Alexa version of that as well. And we want people to access that information by understanding what they can and cannot recycle. But oftentimes people make mistakes about what they can or cannot recycle because maybe they're relying on the packaging labeling, or they're making some assumptions about what we can process. One of the biggest things that we found through study this past year is a lot of people continue to bag their recyclables, putting their recyclable materials in plastic bags. And that presents a problem for us for a variety of reasons, not the least of which it's a safety issue for our employees. We don't want them to have to open bags, so we don't have them open bags. We don't know what's in those bags, and it could be something hazardous, it could be something dangerous. At the very least, it might be something that is garbage and can contaminate the rest of the material on the belt. So we just have those bag materials go right into our residue line, which is our trash line, because it's just not safe for our employees to open them, and it reduces efficiency. Plus the plastic bags themselves are not recyclable, and those create problems for us as well. So we've identified that bag recyclables are one of our biggest problems. Plastic bags, styrofoam, and those things we call tanglers like hoses and wire hangers and ropes and clothing. Those are other things that people put into their recycling cart with good intentions, but cause problems for us because we can't recycle them, but B, they get tangled up in our equipment, and most importantly, they do present some hazards to some of our employees, and safety is obviously our biggest concern at all times.
There are things that Mike wants residents to know at this time.
We get problems with videotapes, cassette tapes, even old 8-tracks from time to time. And that tape is not something that we can recycle. Even the plastic housing is not a recyclable plastic, at least to the folks that we send plastic to. And what we find is that tape will get wrapped around the equipment. Sometimes you can just see it dangling from the overhead conveyors because it just gets stretched out for many feet in yards, and it sometimes seems like there's just miles of tape in one of these old cassettes. There are some niche recyclers of those materials in the United States, but it's usually at a cost. It's not something that we handle. We focus on those things that we can cost effectively collect, cost effectively and safely process, and for which we know that there are stable, consistent downstream markets that can accept large volumes of material.
Last year, they canceled all of their spring events, but made up for it by hosting some additional events. They resumed their regular schedule in July and had a series of regularly scheduled Saturday events through the remainder of 2020.
So we had some of our normal weekend household hazardous waste collection events to which folks can bring their hazardous materials, oil-based paints, thinners, cleaners, batteries, all those types of things that we want to see safely recycled or diverted from landfills. And we did have to cancel a number of those events in the spring of last year, but the second half of 2020 we were able to have our regularly scheduled events plus some additional events to make up for what we had to cancel in the spring. And so throughout the entire calendar year we saw volumes of material and participation at pretty normal levels. In fact, I think we had our third highest year ever last year in terms of participation in material volume. And so we're on track to have our regular series of events in 2021. They'll begin in April, and we have one right here in Southfield near the end of April. That is on our website, and we'll be publishing some stuff about that come next month so people are aware of what the schedule is for 2021.
One common misconception is what plastic is recyclable.
The biggest challenge I think we have is that we have to compete when we're trying to educate people. We have to compete with the labeling on products and product packaging. It's more and more common that brands and product manufacturers and their packagers will label their product as recyclable. And in fact, it may or may not be recyclable. I always look at recycling as it has to be practically recyclable. Just because something might be technologically recyclable doesn't mean that we in fact can recycle it, because again, we have to be able to cost effectively collect it in large quantities. We have to be able to cost effectively and safely process it. And we have to have a downstream market that wants that material at the end of the day. And so the suite of materials that we process here and the suite of materials that we want folks to put in their recycling carts and bins are those items that fit that description. And so we want people to be aware of what those things are, and they can find that out by going to the websites, going to our recycling directory, and maybe using the Alexa version of our app. But we also do a lot of other types of education. For example, we do a lot of direct mail pieces, and people should watch their mailboxes in March for a postcard that will come out that will let them know not just about the hazardous waste events that are coming up in 2021, but on one side we'll have information about how to find out more about what can be recycled and what some of the common problems are. And we just really are relying on people to educate themselves and to follow us and follow the city's guidance on what goes in the carts and bins, so that we can be as cost effective and as safe as possible here at the recycling plant. Some things create problems because they're a contaminant to the material stream, and we just have to weed those things out. But we do find there are other things that are real safety hazards, like, for example, batteries. If somebody were to put a lithium battery in their recycling cart, it very well could start a fire here at the plant, and then we'd have to rely on our safety protocols and our fire prevention measures to identify that and react accordingly. So people can do their part to help us be safer here at the plant in Southfield by making sure they're putting the right things in their carts.
You can support the recycling effort on a personal level.
We don't want plastic bags, we don't want plastic film, we don't want what we call flexible packaging. We want rigid containers and bottles. And if you look at most any rigid container or bottle, you'll see a number on the bottom. And it'll have a little arrows chasing arrow with a number in the middle. And it looks like a recycling symbol, but in fact it's not a recycling symbol, it's a resin code. And that's just identifying the type of plastic out of which that product is made. Doesn't necessarily mean it's recyclable. When it comes to the program here in Southfield, we take plastic bottles and containers number 1, which would be the clear plastic like water bottles. We take number 2s, that's a high density polyethylene, both colored ones like say a detergent bottle, or what we call naturals, unpigmented plastics like a milk jug. We don't take number 3s, that's a PVC that there's no good market for, and we don't want those. And you don't find a lot of those, but you will find some household products that are number 3s, so those should go in your garbage. We'll take number 4s, 5s, 6s, and 7s, plastic containers and bottles, with the exception of styrofoam, which is also number 6. That's an expanded polystyrene foam for which there's no market, and we can't really cost effectively capture that. So it gets a little confusing when you just look at the numbers on your containers, because it looks like a recycling symbol and there's 7 different possible numbers there. So we want people to compare what's on their container to what's on the list of recyclables that we want, and that should help people understand what should go in the cart for recycling versus what should go in their trash can.
People often wonder what they should do with the tops to their water and pop bottles, and Mike explained what happens to them.
The tops should remain on your water bottles and your milk jugs and your detergent bottles, because while it's a different type of plastic, when we bale those up, we'll bale the bottle and the cap up all together, and the plastics processors to whom we send those things will separate them through their process. It's really interesting, actually. It'll go through a shred, So the bale we send, and we'll send them a bale that'll weigh about 1,500 pounds, and we'll send a truckload of bales. They break open those bales, they run it through machinery that shreds it, and then it goes through a wash cycle. And when it goes through that wash cycle and is rinsed, the vinyl caps will float and the rest of the plastic sinks, and they can separate it that way, and then they have two valuable plastic products that they can then make into something else. So the caps on the bottles. But if people just throw their caps loose into their container, we're not going to be able to recycle it because they're going to be so small, it's going to fall out through the process, whether we can't get it up off our tip floor or it falls through our conveyor system into our residue line. So that's why it's important for people to keep the caps on the bottles.
Recycling is one of the most tangible daily activities that a homeowner can do to create a positive impact on the environment and the economy. By recycling instead of landfilling our waste products, we can conserve natural resources, use less energy, and create less pollution.
I would like to talk about the video that we worked with the City of Southfield to create. I guess it was last year or the year before. It's on our website. Time flies, but that video is really great because it describes for viewers the entire process. And it talks about what they should and should not recycle, but also gives some better understanding about what happens once they put the material in their bin or their cart and how that is processed both here at the plant and what happens to it when we send it to manufacturers as raw material to make other things. And you know, it really illustrates the fact that when people are recycling, they're not just saving landfill space, but they're also helping the environment and the economy, because jobs are created as we do value-added activity with all these materials. But beyond that video that's available on our website, we do have other tools that can come in handy for homeowners. We have, you know, schedules about our household hazardous waste events. We have guidelines for what can and cannot be recycled. We have an opportunity to sign up for our electronic newsletter that we send out every month so people can get updated information, and you know, they can also find links to, for example, our Facebook page. They can, you know, like us on Facebook, and we do a weekly Friday feature on social media that they can access. And then there's, of course, access to our recycling directory, which is, we think, kind of cool because you can just type in a material if you have a question about it, and it'll tell you what you should do with that material. Should you recycle it? Should you throw it away? Should you compost it? Should you donate it? And on our website where that directory is, you can also find access to the mobile app. So whether it's, you know, the Apple App Store or Google Play, you can download to your mobile device that directory, and you can sign up on that directory for alerts so you can be notified the day before of a household hazardous waste event, for example. And there's an Alexa version of that as well. So if you have an Alexa device, you can just enable the recycling directory and then ask Alexa to ask the recycling directory, what do I do with this or what do I do with that? And she'll tell you. If somebody put their recyclables in a plastic bag and we can't tell what's in here, you know, we don't know if it's garbage or something hazardous or something recyclable, and we don't, you know, it's just not safe for the employees to be breaking these bags open, plus it slows the process down. You know, here's, again, you know, plastic bags, some of the stuff will fall out, but all this film, this is not recyclable. None of this flexible packaging is recyclable. It might be labeled as recyclable. You can look on there and it'll say, it even says on this package, recycle. Recycle the plastic wrap, but it says store drop off only. This can, you know, there are some retail stores that'll take plastic bags and they'll take, you know, this type of stuff, but we can't process this material here. You know, all this stuff, this is non-recyclable material. It's in a bag. We get a lot of this type of thing. Now the paper on the outside is recyclable, but this shrink wrap stuff, you know, that's recyclable, but this bubble wrap on the inside is not recyclable. And so those are the types of things that we're seeing more of because people are getting their Amazon deliveries and they assume it's recyclable, but it's in fact not. So you can see we got a lot of cardboard here. What we get most of is paper products, a lot of cardboard, a lot of mixed paper. Mixed paper isn't highly valuable. Cardboard's pretty valuable though. One of the silver linings that we've found through the transition of people being at home and getting things delivered is that we're getting that cardboard, and that cardboard has value. So this type of plastic will lead to a line shutdown, because as we get a lot of this and it wraps around the shafts, it will cause them to be inefficient, and we have to shut down the line, go in there and actually take this out physically, and sometimes it requires the guys to spend a considerable amount of time in there cutting it out with saws and wire cutters. Plastic's one thing, but we also see videotapes and hoses and cable, wire hangers. Those things, as they wrap around our equipment, create a lot of problems. They can not just cause the equipment to be less efficient, but it can cause things like sparks. If it's a metal wire wrapped around a moving shaft, that can create a spark, which can create a fire. Obviously, we don't want that. And then the time it takes to remove these types of things from the system is time that is taken away from being productive.
For more information on recycling, watch our Cable 15 recycling special coming up in the near future.
Well, that's it for this edition of Business Matters. To see other editions of Business Matters or other Southfield Multimedia Services programs, go to www.cityofsouthfield.com/cable15 and select featured programs, or visit our Facebook and YouTube channels. Thank you for watching.